Welcome to today's webinar, Puberty and Down Syndrome. Thank you for joining us. My name is Laura Crone, and I'm the Project Manager for Research and Education at the Advocate Medical Group Adult Down Syndrome Center. We are a clinic for adolescents and adults with Down syndrome located in Park Ridge, Illinois, which is a suburb of Chicago. We see patients ages 12 and older, and since opening in 1992, our healthcare professionals have seen over 6,000 individuals with Down syndrome. Our team includes physicians, an occupational therapist, a licensed clinical social worker, patient advocates, support staff, and many others who serve the physical, mental, and social health needs of individuals with Down syndrome. In addition to providing patient care, we offer a variety of research and education opportunities, such as this webinar and our online resource library. Next slide, please. Our redesigned library launched recently, and it contains nearly 500 articles, visuals, videos, and other resources related to health and well-being of individuals with Down syndrome. You can access it free of charge at adultdownsyndrome.org. Next slide, please. Before I introduce our wonderful speakers, I have a few reminders. This webinar is being recorded, and the link to the recording, as well as a PDF of the slides from the webinar, will be emailed to all attendees within 1 week. Additionally, if you requested a certificate of attendance when you registered, you'll receive an email with a certificate also within 1 week. As a reminder, all attendees are in listen-only mode. If you have questions, please feel welcome to submit them throughout the webinar using the Q&A option at the bottom of your screen, and we'll address as many of them as we can at the end of the webinar. I am so thrilled to introduce our speakers today, who are Dr. Hannah Graham and Dr. Katie Frank. Dr. Hannah Graham has served as a family medicine physician at the Adult Down Syndrome Center since 2021, and Dr. Frank has served as the occupational therapist at the center since 2016. Both are also family members of individuals with Down syndrome. In the interest of time, I'm not going to read their full bios, but you can learn more about them using the QR code on the screen to visit the Meet Our Team page on our website. They have a lot of wonderful information to share about puberty, so thank you for being here. And with that, I'm going to turn it over to Dr. Graham.
Thank you so much, Laura, and hello to everyone. It is so nice to be able to spend a little bit of time with you today. So we are going to go ahead and get started. Just as a reminder, this presentation is meant to support families, caregivers, and professionals who care about and for individuals with Down syndrome. The information shared today is for learning and discussion and not to replace medical or therapeutic care. Everyone is different. If you have questions that are specifically about your loved one, you are encouraged to talk to their doctor or therapist. And neither the ADSC staff nor Advocate Health endorse any products discussed in this presentation. All right, so some of our objectives today, talking about puberty and Down syndrome. We hope to understand the basics of puberty and Down syndrome and describe the developmental process and changes. We also will identify strategies and resources to support individuals with Down syndrome during puberty. Okay, so let's get started with puberty. The what? What is it? All right, so puberty is that time in life when a young person's body starts to become sexually mature. Classically, it is characterized by the development of reproductive organs. We can also see rapid growth in height, voice changes, moodiness, and so much more. A lot of questions often come up about the age of puberty. What's the normal age when we start to see some of these changes? When we're thinking about age of puberty in people without Down syndrome, in girls and boys, the normal ages of puberty are slightly different. It happens a little bit earlier in girls. So in girls without Down syndrome, it usually starts, or it can start as early as age 8, but it usually starts around age 11. In boys, it can start as early as age 9, but it usually starts around age 12. Starting before age 8 in girls or before age 9 in boys would be outside of the normal range of starting puberty. So what age does puberty start for people with Down syndrome? Like so many questions when we're thinking about our people with Down syndrome, there are not very many studies that look at puberty in this population. There are very few, in fact. There is some data that suggests that for boys with Down syndrome, they start puberty about the same age as their peers without Down syndrome. But there is also a suggestion that the length of their puberty is a little bit longer. So they start puberty at about the same age, but puberty maybe lasts a little bit longer. There's also looking at girls with Down syndrome, there's some data that suggests that breast development starts a little bit later in girls with Down syndrome, and that it also finishes a little bit later in girls with Down syndrome, and that periods maybe start a little bit earlier for girls with Down syndrome, or maybe not, because the studies are kind of mixed about whether girls with Down syndrome start their periods earlier or at the same age as girls without Down syndrome. We'll get into that a little bit more in some of the coming slides. All this to say that the age of puberty in people with Down syndrome is probably pretty close to people without Down syndrome, with some suggestions that puberty might last a little bit longer in people with Down syndrome. Okay, so when doctors and healthcare professionals talk about puberty and how we describe people who are going through puberty, how we describe where they are in puberty, we talk about something called the Tanner stages. I don't expect parents or caregivers to be thinking about Tanner stages or to be describing their loved one in terms of Tanner stages. But I think it's helpful to have heard that terminology and know that that's what the doctor is talking about if they write that in their note or if they happen to mention a Tanner stage. So this is a system that helps doctors and healthcare professionals describe where in puberty a person might be. And we use Tanner stages to describe some of the different parts of puberty and development. So when we think about puberty for males, and we're thinking about puberty in general for people without Down syndrome, puberty in males in general, the first sign of puberty is when we see an increase in testicle size. When we think about the typical pattern of development, we usually think of it in terms of both testicular and penile growth, as well as pubic hair growth. And we use Tanner stages to describe both testicular and penile growth and pubic hair growth. And that helps healthcare providers know where in that phase of puberty a man might be. In this chart, I included height and age just as a reference to kind of see where growth spurts match up along with these Tanner stages, as well as roughly some of the age ranges where we see some of these Tanner stages. But when we're talking about Tanner stages, we're really referring to what Tanner stage a man might be at for testicular and penile growth, as well as for pubic hair growth. So as you can see, Tanner stage 1 is referring to pre-puberty, so childhood, before puberty has started. And then Tanner stage 2 is when we start seeing enlargement of testicles and scrotum, but not the penis. We see sparse, slightly pigmented pubic hair. And this stage usually starts between the ages of 9.5 and 14 years old. Tanner stage 3 is when we see continued testicular and scrotal growth with penile growth. Still sparse, but darker, coarser, more curled pubic hair. This is also where we start to see peak height velocity. So that classic growth spurt really is happening during Tanner stage 3. This is typically happening during ages 11 to 15 in boys or men who are going through puberty. Tanner stage 4, still continued testicular, scrotal, and penile growth with maturation of the penis. We see adult type pubic hair, but the area that is covered is smaller. We see peak height velocity, facial hair, acne, voice change. So a lot of those classic things that we hear about in puberty is happening during this Tanner stage 4. And again, this is happening kind of over a wide age range that's considered normal. And that's between the ages of 11.5 and 16.5. And finally, Tanner stage 5 is when that boy or man has now reached mature adult male physiology. We have mature male genitalia. We have adult type and distribution of pubic hair with spread to the medial thighs. And typically we see no further height increase after age 17. I think it's helpful to know that in boys or men who are going through puberty, we can sometimes see breast tissue that might appear around stage 3 and usually resolves during stage 4. That's called gynecomastia. And it happens just because of some of the hormone changes that are going on in the body during puberty. So it's helpful to know that that can be a normal part of puberty for males as well. So this is kind of a rough, typical pattern of development for boys in general who are going through puberty. So what about this might be different for males with Down syndrome who are going through puberty? Again, we see a lot of these same milestones happening for men with Down syndrome who are going through puberty. The limited data that we have suggests that men with Down syndrome might complete puberty a little bit later than men without Down syndrome. So I have highlighted here that Tanner stage 5 might be completed at a slightly later age. When we think about fertility, I think when we're talking about puberty and sexual maturation, fertility becomes really important. People often ask, is this loved one of mine with Down syndrome fertile? Are they able to become a parent? Do we need to be thinking about sexuality and birth control for this person? The answer is that yes, men with Down syndrome can be fertile. There is some data that men with Down syndrome might have reduced fertility, they might have a decreased sperm production, but some men with Down syndrome are fertile, and there are many documented cases of men with Down syndrome who have fathered children. So we should consider men with Down syndrome to be or to possibly be fertile. Some of the other parts that come with puberty are nocturnal emissions and masturbation. So this is looking at the general population, trying to get some data and some information about frequency and rates of nocturnal emissions, which are colloquially known as wet dreams in the general population. So nocturnal emissions are common in the general population. There is some variation amongst different cultures for how frequently they occur or are reported. Seems like they are typically beginning between the ages of 12 and a half and 15 and a half years old, and usually 13 to 14 seems to be the most common age where they are starting. Masturbation is also reported to be common, and the frequency of masturbation increases with age. So one study looked at males and found that 62.6% of males by the age of 14 had reported masturbation, 80% of males at age 18. It's important to note, I think, that there were no studies that we could find that were specifically looking at men with Down syndrome and their experience with nocturnal emissions and masturbation. Thankfully, in a couple of slides here, Katie's going to give us some great information about how to provide some education for men with Down syndrome about these topics. Okay, so puberty for females. So the first sign of puberty in females is classically breast buds, which is the start of breast development. Again, we're going to be using Tanner stages to help us classify where in that pubertal development a female might be. We're looking at both breast development and pubic hair growth again, with Tanner stage 1 again being pre-puberty. Tanner stage 2 is when we start to see the breast buds, and then we see sparse, slightly pigmented pubic hair. Tanner stage 3 is when the breasts are further enlarged with a rounded contour, still sparse with darker, coarser, more curled pubic hair. Again, Tanner stage 2 and 3 is when we're seeing some peak height velocity, right? So those growth spurts are happening. Tanner stage 3, we see acne, body odor, armpit hair, all of those other things that can happen with puberty. Tanner stage 2 is happening between the ages of 8.9 years, 12.9, almost 13 years. Tanner stage 3, about 9 and almost 10 years to 14 years old. Tanner stage 4, we see the areola and nipple form separate mounds on the breast, adult pubic type hair, but adult type pubic hair, but the area covered is smaller. This is also when we see that the first period might start. The age for Tanner stage 4 is between the ages of 10 and a half and 15 years old. And then Tanner stage 5 is the mature adult stage, mature adult development. We see adult type and distribution of pubic hair. Sometimes with spread to the medial thighs. There's no further height increase after age 16, typically in women. Okay, so how does puberty look different for females with Down syndrome? Well, limited studies, but one study suggested that breast buds start a little bit later and finish a little bit later. So breast development starts a little later, finishes a little bit later. There's some question about age of first period. There's one study that says it happens maybe a little earlier for women with Down syndrome. Another study says that it happens at about the same age as women without Down syndrome. So first period may start a little bit earlier or pretty close at least to the average age for the general population. And then the length of puberty is possibly a little bit longer for females with Down syndrome as well. So when we think about fertility for females with Down syndrome, again, people ask, is this woman with Down syndrome fertile? We know that the fertility rates for women with Down syndrome are reduced, but there have been many documented cases of women with Down syndrome giving birth to children. I think it's kind of interesting that less than half of the children who are born to a woman with Down syndrome have Down syndrome themselves. So if you think about genetics, from a purely genetic standpoint, you would think that there would be a 50% chance that a woman with Down syndrome would have a child with Down syndrome. But that's not the case. It's less than that. We don't know exactly why that is. It might be that there's those fetuses that have Down syndrome are more likely to be miscarried or something like that. But regardless, I think it's kind of interesting, and it allows us to dust off our genetics a little bit and think about that. It's also interesting to note that women who have mosaic Down syndrome are more likely to be able to become pregnant. So women, like men with Down syndrome, may have reduced fertility, but there are many documented cases where people with Down syndrome are fertile and able to become parents. Thinking about periods. So the average age of first periods for the general population is around 12, 11, 12, somewhere in there. And I had mentioned earlier that there are some studies that suggest that the age of first period is a little bit earlier in women with Down syndrome, but then there's other studies that suggest it's about the same age as women without Down syndrome and about the same age as your mom, right? So a woman is likely to get her period around the same age as her mom got her period. So what this tells us is that we don't know the exact answer, but women with Down syndrome start their periods close to the same age as their peers. We have seen over the years in our work with our patients that managing periods can be very challenging for some of our women, but we've also seen that with support and the skills to succeed can be learned. And so Katie's going to talk to us a little bit more about that soon. When we think about different ways for managing periods, we sometimes recommend period kits for school. There's a variety of products that are now available. There are the traditional pads and tampons, but there's also period absorbent underwear. I don't know why it took so long for those to be invented, but these are underwear that can be washed and reused and worn to manage periods. With a lot of practice, women with Down syndrome can be independent or partially independent with managing their periods. There are a lot of different apps and devices and resources available for tracking a period, knowing when it's going to be coming. Finally, there are things like medical options for period suppression. But in our experience, that doesn't always have to be the first thing that we tried, because we've had success finding that our women are able to learn to manage their periods with a lot of practice and support. When we think about periods and fertility, questions about contraception often come up. There can be a lot of different reasons for using contraception. It might be for contraception to prevent pregnancy. It might be for heavy or painful periods, for period suppression, for moodiness and PMS, many other reasons. There's a lot of different types of contraceptives. This is beyond the scope of our talk today, but we do want to share that there's more information available in our resources, and many more resources available for you to learn more about contraception and how that we need to think about contraception in the context of women with Down syndrome. Okay, I've referenced it a little bit, but what about mood and behavior during puberty? We know that mood swings and irritability are common and normal during puberty. I think it's important to note they are normal during puberty. It's also relevant that 1/2 of all cases of mental health disorders reportedly start before age 18, and the average age of onset is 14. So when people develop a mental health disorder like depression or anxiety or something like that, the average age of diagnosis is 14, so that is developing during puberty. We also know that mental health disorders are more common in adults with Down syndrome, up to 40%. So we are not going to be surprised then when we're seeing that our adolescents and people with Down syndrome are experiencing mental health disorders, moodiness, irritability. It's all common. And we get to sort out which parts of it are the normal moodiness that is manageable, and which parts maybe are signs of a mental health disorder and might need a little bit more support. We do have so many resources on our website to help support families, caregivers, providers in treating mental health in adults with Down syndrome. So we wanted to share some of those resources with you today. Going into the moodiness and behavior and mental health is probably beyond the scope of our talk for today, but we just want you to know that there are so many resources that we can reference and help support our individuals with Down syndrome. With that, I'm going to pass it over to Katie, and she's going to talk a little bit more about how to teach some of these things about puberty to individuals with Down syndrome.
Wonderful. Thank you so much, Dr. Graham. All right, so now that you know the important basics, the facts about puberty, you probably want to know, how do I even begin to talk to my loved one about all of these changes? If you weren't aware, and some of you who have heard me talk before probably know this, but my dissertation was Parents as the Primary Sexuality Educators for Their Adolescents with Down Syndrome. So this is a very important topic for me. Clearly, it's important for you if you're here, but oftentimes parents feel nervous or anxious about talking about many of these topics. And so I want to try to help you find ways to make it a little easier on yourselves. So the first thing I want you to do is to be able to recognize that sexuality is a healthy and positive aspect of being human, right? So you're just recognizing that each person is a sexual being. And so in this stage, you might find resources that are going to be useful, even if it's for future conversations. And you're going to try to prepare yourself to have very specific discussions about some aspects of sexuality or puberty, and maybe even to set boundaries and social expectations. And like I said, many parents fear that maybe talking about sexuality topics are going to open up Pandora's box and their loved one's going to want to engage in anything that is discussed, but really this is a myth. The other thing that's important is that you need to acknowledge your own attitudes about sexuality and disability, because the topic of sexuality and disability is a complicated one, and it really is laden with our own values and beliefs about ourselves and our bodies and our relationships with others. And these beliefs in turn can really impact our interactions with individuals with Down syndrome. So it's important for you to communicate your values, but also not to allow them to hinder your teaching. And this is why I believe that the topics of sexuality should be addressed at home and not at school, because school is not able to share the values that you hold as a family. And then when you're sharing the information, you really want to make sure that the information is accurate and understandable and timely and relevant. And again, that's why it's really important to happen at home and not just to rely on school. And you want to begin with the most immediate need. So today we're talking about puberty, so it could be things like erections or menstruation, right? And so you focus on that and you don't worry about other topics. You want to consider the individual's learning style. We know that many individuals with Down syndrome learn best with visual strategies and simple language. You want to use teachable moments. So when we think about a teachable moment, perhaps you're watching the TV show and one of the characters is pregnant, or someone, your loved one's cousin is pregnant. And so you can use that as an opportunity to figure out what they know about pregnancy. You can ask them questions and then you can teach them about pregnancy, right? Or if they're watching a TV show and the girl gets her period, or, something like that. They're talking about dating and relationships, talking about boyfriends and girlfriends, and you can use those opportunities to make it seem like not such a scary topic or like a serious topic. It's just a conversation you're having. Um, and then it's also really important to be a role model and to model healthy attitudes and respectful boundaries. And there is a slide on consent here, but it's things like if we're teaching consent, which consent means to give permission, and we can give permission and we can take away permission, then as parents and caregivers, we should be knocking on the door before entering a private space with the door closed and wait for permission to enter. If we have to help with intimate self-care needs, we should ask permission before we touch their body or invade their personal space, right? Because they need to know that importance of giving permission and not giving permission. So here's your role as a sexuality educator, but I like to say that there's two approaches when we talk about sexuality education. And the first one is planful. So this is when a situation involving sexuality or sexual behavior arises, the parent or disability service provider, caregiver takes the initiative to teach, right? Instead of punish or scold. You're being planful. It kind of creates a learning experience for everyone involved, right? And if we're being reactive, this is when a situation involving sexuality or sexual behavior arises, we end up trying to restrict or punish or limit the behavior or communication. And this can contribute to a negative message about sexuality and sexuality education. And you're probably saying, Katie, well, how can I be planful if it already happens? Well, you can, right? You just want to make it a teaching opportunity in the moment instead of reacting negatively or punishing, right? And I'm going to give you an example of what that might look like. So we hear this a lot. Your teenager is frequently humping or grinding on the floor or on furniture, right? And so let's say this happens in our doctor's office and the parent is mortified, right? So they yell at them to stop. They tell them that they're embarrassing them. And then you're like, and because you did this, I'm going to take away your iPad. So this kind of makes them feel shame for doing something that's natural, and they may not necessarily understand what they did was wrong, even though you've said many times you're supposed to do that in private or, however it is that you've taught. But if we were to take a planful approach, we could just try to politely redirect. Maybe say something like, please stand up or please sit in the chair, right? And then you're going to use this as a teaching opportunity, maybe not right there in the moment, like if you're sitting in the doctor's office, but you're going to want to teach them about concepts of public and private. You're going to want to tell them that that action needs to be done in private only, and maybe confirm what private means, like where they have a private space. So it could be just their bedroom at home when the door is closed, right? Or maybe it's just the bathroom at home because they share a bedroom. And then maybe you review some masturbation visuals, which I'm going to show you in a minute, and let them know that they can come to you with any questions. And when you use this planful approach, it really makes it a teaching opportunity. And in the future, if you see them maybe like initiate a movement, right, you can have a code word so that you're not going to say something like stop touching yourself or stop humping. You might have a code word that's like daisies, and they know what daisies means, but no one else would. And so you're not calling out the behavior. All right. So what kinds of resources can you use to help teach some of these concepts. So like I said, consent to me means give permission, and we need to give permission about who sees our body, how someone touches our body, right? Things like that. And so here is a story. Consent is a really hard thing to write a story about. I'm not going to lie, but if we just talk about consent as giving permission and that you can give it and take it away, um, and that no one should be doing anything to you when you say no. And then if they do, talk to a trusted adult. That's kind of like the easiest way to talk about consent. We also talked a little bit about privacy. So I like to think about having private body parts, private places, private behaviors, and private talk, right? And so we have a resource. This one we have both for male and female that just talks a little bit about private versus public, different things you can do. Again, so it talks about private behaviors, private places, things about being in, it doesn't talk about body parts specifically, but things like being in our underwear. But then we also have stories about public and private. And so privacy is when no one should see my body without my permission. Privacy is when the door can be closed, maybe even locked. And we talk again about the behaviors, the body parts, the places, and the talk. Whereas public means lots of other people are around and they can see what I do, say, and show, right? See and hear what I do, say, and show. And so it's important to understand those differences. We also have a ton of resources on hygiene. And so I'm just going to show you a couple of them, but we have a story about grooming or hygiene for girls. We also have grooming and hygiene for boys. We have a video about washing your hands, and this is a visual story that goes along with the steps to washing your hands. You can have things like a shower routine. And what's really great in our resource library is that your loved one may not need all of these steps. And so you can make your own shower routine, or perhaps they need reminders to put on deodorant. And so we have it for roll on and spray deodorant. We also have a personal hygiene chart. Again, this is something that you can individualize for your loved one because perhaps they don't need to wash their face in the morning and at night because they shower every day. So you can take that off. Or maybe they only choose to brush their teeth once a day and everyone's kind of like accepted that fact, so you don't do morning and night. You can use these personal hygiene charts two different ways. You can think about it as these are all the things you have to do, and you can mark it off when you do it. Or you can already have it pre-marked. Like I know that I shower 3 times a week, and so I'm going to shower on Tuesday, Thursday, Saturday. Right? But then perhaps we still wash our face every day, right? And so then you can have it marked so that they know, oh, it's Tuesday, it's a shower day, or oh, it's the first day of the month. I have to look at my nails and trim my nails, or whatever that might be. We also have different hygiene tasks like brushing teeth and a bunch of other topics. For puberty, we know that there's a lot of body changes, and that can be really confusing for someone with Down syndrome. And so we have a story for girls and a story for boys about what is happening as their body changes, as they're going through puberty. For girls specifically, we have stories about menstruation. So one about getting their period, and then one about when to change their menstrual hygiene product, because sometimes that can be the challenge, is they don't know when to change it. And so this story just kind of talks about like maybe you change it every time you eat. So you change it like when you wake up and at breakfast, and then you change it at lunch, you change it at dinner, and then maybe before bed. Something like that. If they need something more specific, you can always have timers go off. You can have, if they have an Apple Watch, you can have reminders. There's so many different tips to help remember to change your menstrual hygiene product. And as Dr. Graham mentioned, there are a variety of menstrual hygiene products now. So we have stories about when to change your period underwear, maybe if they use tampons, how to change the tampon, or even how to change a pad. And again, this isn't like, some people might have different steps than we've put, but this is just like a good way to start. And the other thing, in addition to period absorbent underwear, there are also period absorbent bathing suits now. And so that's really great because we know a lot of our patients may not be able to swim when they're on their period if they use pads. And so now they can use this period absorbent underwear so that they can still participate in swimming. And I bet you could probably even use those for gymnastics. Dr. Graham also mentioned menstrual hygiene tracking, so you can use a calendar. There's different apps that you can use. They can just keep a journal. Any of these tips can help them be more independent. We know a lot of the parents do it, even if their daughter or loved one is also tracking. Dr. Graham also mentioned period kits, so that can be like a little bag that they always bring to the bathroom with them that might have a change of underwear in there, whatever menstrual hygiene products they use are in there. Maybe even a bag that if they like soil their underwear or they use the period absorbent underwear, that they can put that underwear into a plastic bag inside their period kit. And again, these can all change from, person to person, make it individualized, whatever they need. Maybe there's a mirror in there if they need a mirror. I mean, there's so many things you can do to put in a period kit. We also have stories about PMS symptoms, so like what PMS means and what we can feel when we are menstruating, and then what we can do to help ourselves feel a little better. Dr. Graham also mentioned things like wet dreams and masturbation. So we have stories about erections because, again, this can be really confusing for a boy, especially if it happens the first time. Or like, what do I do if it happens when I'm out in public? And so we have stories for that. And then we have stories about wet dreams. So Dr. Graham mentioned nocturnal emissions. And so what they can do if it happens, kind of reminding them that their sheets might be wet, their clothes might be wet, but they didn't have an accident, that this is something normal and what they can do to, remedy the situation. And we have stories about masturbation for both boys and girls. So again, like that you can do it, and then another one that's like steps to doing it. There are also some good resources that families can use with their loved ones. Some of these are books for people with disabilities, but like the Guy Stuff book, the body book for boys from American Girl, is not disability specific. So these are things that they can look at themselves, but also you could use that as a moment to like share with them some information. If you have if they have questions, you can look at the book together. Same with girls. The all of these except the last one are more for individuals with disabilities, but I've heard some really great things about the books by American Girl, which is why I wanted to include those. And then the Care and Keeping of You book. So there's the Care of Keeping of You 1, the body book for younger girls, and they also have the Care of Keeping of You like 2. It's not a second version, it's just like an additional book with information. All of the resources we talked about today are in our resource library. You can scan this QR code. This QR code specifically lists resources that I didn't even talk about. It lists books for parents. It lists websites that you can go to, different websites that have videos. So amaze.org or the National Council on Independent Living have videos. The amaze.org is more cartoon videos, and the NCIL videos are people with disabilities talking about different topics. So like one of them on the NCIL website is talking about how to put on a condom. Right? You may need to work on that with your loved one. And so here's a video that they can watch and learn why it's important and how to do it. And so that's what this QR code is for. And then we'll have a QR code again at the end that has all of our resources. You can just type in the search box, sexuality or puberty, and a variety of things will come up. We also wanted to share some other resources. This is something that Dr. Graham actually is the author of, the Women's Health and Down Syndrome through the National Down Syndrome Society. So this is a great booklet that is free. And again, you can scan that QR code if you want. And it talks about a lot of the things we talked about today, but then it talks about women's health throughout the lifespan. So today we focus primarily on puberty, but this even goes into menopause and then resources for menopause, which we also have in our resource library. Another thing that has been facilitated with National Down Syndrome Society is this Care Down Syndrome project. And this is a great education and resource hub for healthcare professionals where they can get free CME and learn a variety of things about the health and care of individuals with Down syndrome. Families are also welcome to access this and learn the information, but we encourage you to share this with your loved ones, healthcare providers, especially if they may have less experience working with individuals with Down syndrome. And then another thing we wanted to share is DISMIG USA, so the Down Syndrome Medical Interest Group. This is something that both Dr. Graham and myself are members of. And this is a group of healthcare professionals who care for individuals with Down syndrome, and we meet annually at our own symposium. But we have a variety of opportunities for individuals who have interest in working with people with Down syndrome to learn from those of us who may specialize in Down syndrome. And the thing I want to highlight here is that Project Echo, that second bullet point. So Project Echo is for healthcare professionals only. This is not available to families. However, if you have questions and your healthcare provider does not know the answers, they can submit to present at Project Echo and present the case of your loved one. And then the whole point of Project Echo is for all of us to learn from each other. So while there's supposed to be experts on the call, it's basically a conversation. And so then your healthcare provider can learn or get information about how best to address the concern that they're having some trouble dealing with or managing at the time. Like Laura mentioned at the beginning, here is our updated resource library. Again, that's the QR code to access all of our resources, but you can also just type in adultdownsyndrome.org. And with that, I believe it is time for some questions.
Thank you both so much. You shared such a wealth of information. And we do have some questions, and we're going to try to get to as many as we can in the next 15 minutes or so. And if we don't get to your question, please check out our resource library because there's a lot of information on there. So one of the questions we received in advance was, are there any co-occurring conditions that tend to start during puberty? So things not related to puberty, but other health conditions that families might see.
I think yes. We definitely can see that adolescence, because I think it's because it's the time when when the body is transitioning from childhood to like sexual maturity. Puberty is when we are starting to see maybe some of the adult diagnoses, right? That's when your body is starting to be more of an adult as opposed to a child. So I mentioned earlier that we can start to see more mental health diagnoses can start to kind of show themselves during puberty and adolescence. When we think about people with Down syndrome, one thing that we sometimes see pop up then is like, along with the skin stuff, you know, we see a lot of skin things in people with Down syndrome. But acne is like a normal part of puberty. But beyond acne, we can also start to see hidradenitis pop up during puberty. Hidradenitis is suppurativa is the fancy name for boils, right? And so it's kind of like these recurrent boils. It's actually an inflammatory condition, almost driven by the immune system, and it can be really painful. And it can lead to like tracking and even scarring in severe cases. And so that can start to happen during puberty, probably because there's a hormonal component that's driving some of the inflammation that happens. So I think it's helpful to think about puberty as the time when the body is transitioning from childhood to adulthood. And so we can start to see some of the more adult conditions presenting during adolescence.
Thank you. Do you have any resources for someone questioning their gender identity?
So we don't actually have any in our resource library other than on that other page where there's sexuality resources. There's a great website called genderbread.org. The NCIL has videos about gender identity. So we have not put any specifically that we've created, but we have shared resources in our resource library about from other organizations.
Thank you. How do I approach puberty with someone who has very limited speech and language and who could not ask questions?
So that's what our pictures are for. Many individuals don't actually even know that they should be asking questions. And so again, that's another reason why I think it's so important for parents to take the initiative. And that's what's so great about the teachable moment. So you can kind of like put out a story, see if he's interested in looking at it. And then if he's not, then you just leave it out. And then perhaps maybe he'll bring you the story and then you can talk to him about it. But again, that's why having these pictures and stories are so helpful. Because just because he might not have the words to use doesn't mean he's not understanding what's happening to him and he can't understand what you're saying to him.
Thank you. You guys are asking so many wonderful questions. Do you have recommendations on how to support people with some of the puberty changes who may still be using diapers?
Oh,
Things
I didn't
like
know if Dr. Graham was going to chime in.
menstruation or nocturnal emissions, how to know if those things are happening.
Well, I think with menstruation, we would definitely know. And we actually do have some women who will use adult diapers during their period because that's just an easier way to manage it. Also, because perhaps they're incontinent. Some might not even be incontinent, but it's just more comfortable for them for some reason than using a pad. And then it's something that they can change on their own. As far as nocturnal emissions, I mean, if someone is incontinent, then they're used to being in that wet diaper, and so um, they may not notice the difference, but I still think it would be something important to kind of use that story for so that they understand because I mean, I don't know. I'm a woman, so I don't know if uh, a boy or a male feels that they're having a nocturnal emission, right? Or like he could still wake up and have an erection even though it's in his diaper and he might not understand what that means. So I still think using the stories is really important just so that they have an understanding of what could be happening in their body.
Thank you. So Katie, you had mentioned that it's important to have a planful approach, but what if you've done that and some of the challenging behaviors are still happening, like doing inappropriate things in public? Is punishment okay in that case, or how do you recommend approaching those kinds of situations?
Well, I would never use punishment, only because punishment often is not gets separated, so they still can't understand that the punishment's related to whatever that activity, that negative activity or behavior that they did. Um, and punishment is still more of a reactive response, so you're not, again, like normalizing something that's happening. You have to keep teaching and you want to keep practicing because, right, most of the things they learned, they did not learn overnight. It took time. And so you have to respect that. And yes, this is an uncomfortable topic to like have to deal with and deal with, inappropriately in public. You can help excuse them and like take them to the restroom. You can, um, Sorry, I totally lost my train of thought. I was thinking of something before I finished the last thought about a good strategy for this. Um, I apologize. I don't know, but still, even going back to punishment, like if you were to take away their iPad because they were touching themselves in public, there's no connection, right, to that. They're not going to, oh, I guess the other thing I do think is depending on why they're doing it. Are they doing it because all of a sudden they have an erection in public and they don't know that they're not supposed to touch it. And so like they're like, oh my gosh, my penis is big. I need to hide it or I need to touch it. Maybe it'll go down or it's actually going to make it get bigger or stay large. Um, and so I think trying to use the teaching opportunities as much as possible. Oh my gosh, I had it again and I lost it. But the functions of behavior. So again, if they're doing something like that for attention, then we want to give them positive attention when they're not doing it. I love how you have your nice hands in your lap. I like that you're keeping your hands to yourself. I like that you're sitting so nicely. Whatever it is, they're doing these behaviors for attention and you're giving them positive attention for their good behaviors, then perhaps they won't do those less desired behaviors because you're positively reinforcing that negative behavior when you're drawing attention to it, if that makes sense. So it's important to understand why they might be doing it. Is it something physical going on? Like maybe they're just adjusting, which lots of boys and men do. But it's just individuals with Down syndrome are constantly under a microscope, whereas like if their brother did it, no one would even notice. And so I think that's important. But I think it's also individually specific. And so we can't really get into that here. But hopefully those are some strategies that could be helpful.
Thank you. Do you have any data or experience on length of periods and if that's different in women with Down syndrome compared to women without Down syndrome?
So I have not really been able to come across any of this in the literature, but from our anecdotal experience, I think it seems like a lot of our women with Down syndrome actually seem to have shorter periods. Typically, like 4 to 7 days is considered the normal, like a normal length of period for women without Down syndrome. And I think most women with Down syndrome fall in that range, and sometimes even on the shorter side, like 3 to 5 days. But there are certainly exceptions, and sometimes we see women who are having heavier periods or really heavy cramps with periods. And then we treat those conditions the same way we would in women without Down syndrome.
Thank you. We've received several questions about tampon use and how common or uncommon it is, if it's comfortable for women with Down syndrome to use tampons. So would you mind speaking on that?
We could probably tag team this question, Katie.
All right, you want to start?
Sure. I think that it's probably not very common for our women to use tampons. I think most of our women are not using tampons to manage their periods and probably prefer some of the other methods for managing periods, like pads or period absorbent underwear. There's even period absorbent swimwear now, which is really nice for our women who love to swim. Maybe I have women who maybe couldn't go swimming certain times of the month, and now they are able to go swimming whenever they want because of that period absorbent swimwear. So that's a great invention. That being said, I think there are some women with Down syndrome who are able to learn how to use a tampon. It just takes a very trusted caregiver to learn that technique so that you learn it in a safe way to prevent abuse and to also always make sure that we are teaching correct things about privacy and about who is allowed to touch and be involved in private parts. And I know, Katie, you work a lot with people when they want to learn that skill. I work with Katie to help teach that skill to our patients. So what do you do, Katie?
Yeah, well, so I don't actually. I think there may have only been one patient ever, and I've been working with patients with Down syndrome since 2006 that has ever used a tampon that I've actually worked with. That doesn't mean there haven't been other women with Down syndrome that I've interacted with that uses tampons. One of the challenges with tampon use that I find is that they don't have that visual reminder to help them know when to change it, right? Because if they don't see it, like if they have a pad, they know, oh, I can see that my pad is pretty full. I should probably change it. Or I just see that there's blood in my pad, so I'm going to change it. But with a tampon, they don't know. And so sometimes, especially for those who might change their menstrual hygiene product every time they go to the bathroom, they may be pulling out the pad and it's not hasn't had to absorb very much, and so then that could be painful. The fine motor skills to put in a pad can be challenging. Some people don't want to use the plastic applicators. Um, so can it happen? Can it occur? Yes. Um, but like I said, it really does take a trusted adult to work with that individual to figure it out. And again, that could be why they have a mirror. So maybe they bring a mirror into the bathroom. It's part of their period kit because they need to be able to see where the tampon goes, because they can't just like feel and know. Um, but yeah, I don't, I don't encourage tampon use if they don't absolutely need it, just because I fear more about them forgetting that it's in there or changing it too soon, not changing it at all. Um, and again, because we have period absorbent swimsuits and things like that, I think there's some great alternatives so that they don't have to use a tampon if they don't want to.
Thank you. Do you have any resources to help prevent sexual abuse?
Yeah, that's a really great question. So the number one way to prevent sexual abuse is to educate. So I think using the resources that we have shared today that are in our resource library is the best way, because if the individual knows what's supposed to happen or not supposed to happen, then they will know um, how to stop it. They will know that if it happens, that they're supposed to tell somebody. Um, The other tricky thing about sexual abuse is that we do know that there's a higher percentage in individuals with intellectual and developmental disabilities, and it's often by someone who they know. And so that is why consent is so important and why I stress that. I don't ever want to be the fearmonger and scare parents into talking about sexuality education. Um, but I also think it's important. And so with education, we can prevent sexual abuse. But we do have resources in our resource library. Again, if you go to that sexuality page, there's resources in there that talk more about sexual abuse and how to prevent it. But like I said, consent is the first way to start.
Thank you. What are the cons or negative side effects to suppressing periods in girls or women with Down syndrome?
I can talk a little bit about period suppression. Period suppression is a medically safe practice where birth control pills, hormonal birth control pills, are given in a continuous fashion so that a woman does not get her period. So usually when you have like a classic birth control pill, a pack of pills, there's like 3 weeks of active pills, and then there's 1 week of kind of like blank pills. And that 1 week of blank pills is when a woman would get her period. And then when you do period suppression, you skip that week of blank pills and you just start a new pack so that you just continuously take the birth control pill so that you don't get a period. So when I say it's considered medically safe, it's because the hormonal pills are keeping the lining of the uterus at a safe level so that a woman does not need to have a period and bleed, right? If a woman doesn't have a period naturally for several months, the lining can build up and get too thick, and that can be problematic and dangerous. But when a woman is on the birth control pill, it's keeping the lining at a safe level, and so it is considered safe for her to not get a period and to just be on those birth control pills. It is not recommended to start period suppression before a girl has started her periods. So a girl does need to start her periods before period suppression should be considered or used. I think one thing that becomes particularly important in our population is that birth control pills have not been studied in women with Down syndrome. And there are some concerns that our population might be at higher risk of some of the side effects from birth control pills. There's no studies looking at blood clot risk in adults with Down syndrome, so we don't know if maybe our women are at higher risk of blood clots. We know they're at higher risk of autoimmune diseases, which can increase your risk of blood clots. And we know that birth control pills, some of them can increase your risk of blood clots. So all that to be said, we don't know if women with Down syndrome might experience different risks from birth control pills compared to women without Down syndrome. So we always have to have a risk benefit discussion when we're thinking about adding a prescription medication. And we have to make sure that the benefits are really going to outweigh the risks, especially if we don't fully know what all the risks might be. I also think it's really important to keep in mind that when we have women with Down syndrome or girls with Down syndrome who are first starting their periods, they can be very overwhelmed and it can be a very scary thing. But we have seen so much success over the years. And I meet so many girls and women with Down syndrome who are independent or partially independent and who have really learned some good skills for managing their periods, that period suppression does not need to be the first thing that we try when we are helping our women to be independent or to manage their periods. That when we supply the resources and we help them with the practicing, that we really do see growth and progress. Sometimes I think that the visuals of even like taking a pad and like putting like red food coloring on the pad as a way of practicing like what it's going to look like there's so many different techniques that are out there, but when we give women the time to practice those skills, we see that they are able to learn it. So period suppression, it can be an appropriate choice. It's considered medically safe, but it doesn't always have to be the first thing that we try. And it needs to be a risk and a benefit discussion between each individual woman and her healthcare team.
Thank you so much. And unfortunately, we are out of time. We could keep talking for hours on this topic, but thank you so much to Dr. Frank and Dr. Graham for presenting. As mentioned at the beginning, we are going to be sending out a link to the recording as well as the slides within 1 week. And if you would like to support our mission, you can scan that QR code. We're able to offer webinars such as this one through the generosity of donors. So thank you again, and we hope you have a wonderful rest of your day.